Hi, my name is Lily Weitzel, and for my fifth sports med project, I did the rehab of a periacetabular osteotomy, in other words, known as a PAO. First of all, what is rehab? The purpose of rehab is to recover strength, mobility, and function after surgery. The common methods are physical therapy, exercises, and assisted devices like crutches. Goals in physical therapy or rehab is to help patient regain independence and prevent complications. Why do you get a PAO? Some reasons are hip dysplasia, which is to correct an improperly formed hip socket, pain relief, to alleviate chronic hip pain caused by misalignment, joint prevention to delay or prevent the need for total hip replacement, improve mobility to restore better joint functions and range of motion, and then lastly, prevention of arthritis to reduce the risk of developing arthritis in your hip at a younger age. Next, I'm going to show the surgery video.
Over the front of the pelvis. The muscles are gently separated from the pelvic bone in order to protect nearby nerves and blood vessels. The contemporary technique that is used does not require any muscle detachment, thereby permitting faster healing and recovery. After exposing the pelvis, specially designed chisels called osteotomes are used to precisely cut the pelvic bone in 4 locations so that the hip socket can be completely detached and repositioned. Repositioning of the acetabulum is accurately performed using X-ray guidance. And then the hip socket is fixed in place using between 3 and 5 screws, depending upon the type of disorder that is over the front of the pelvis.
So, then next is an overview. The purpose to treat hip dysplasia by realigning the hip socket. Goals are to reduce pain, improve stability, and prevent arthritis. And then the procedure is repositioning the acetabulum using bone cutting and screws. The recovery time is 6 to 8 weeks on crunches and months of physical therapy, up to about 6 to 8 months. It's best to get this done in younger patients with hip dysplasia and healthy cartilage. They usually don't do it after the age of 35. Some restrictions you have are you're non-weight bearing, so limited to non so there's no or partial weight bearing on the operating leg to 6 to 8 weeks. It is a toe touch weight bearing. So it's about 20 pounds is what they usually say, but just toe touch. Activity, avoid high impact sports like running, jumping, all of that for 6 months. Motions, restricted hip movements to prevent stress on the healing joint. It is usually about a 90-degree where you can't go past 90 and you cannot cross your legs. Driving, typically restricted until cleared by doctors, usually 6 to 8 weeks. And then lifting is avoid heavy lifting during early recovery. And then signs of symptoms of hip dysplasia, which is the main case to get this surgery, is hip pain, persistent discomfort in the groin side or the front of the hip, especially during activity. Your hip also feels unstable, feeling like the hip might give out or is just unstable, limited range of motion, difficulty with the movement like bending, squatting, or spreading legs, clicking or popping, sensations or sounds in the hip joint during movement, and then your hip is pretty stiff, trouble moving the hip after sitting or resting for a while, fatigued, hip or leg tires quickly during physical activity, and then early arthritis is symptoms of osteoarthritis, pain/swelling in younger patients. Now we're going to talk about the phases of rehab. Phase 1, 0 to 6 weeks. The goal is to protect the hip, manage pain, and prevent stiffness. This surgery, you are in the hospital for up to about 4 to 5 days, really, just because you do have an epidural in to prevent taking all the heavy narcotics. And then weight bearing is non or partial weight bearing with crutches, like I said, about 20 pounds, which is toe touch. Exercises, gentle motion, ankle pumps, isometric quad glute squeezes, just so you can prevent blood clots because you're not really moving your leg as much as you should. Therapy is focused on safe movement and early mobility in just everyday life, like getting into the shower and getting your legs into bed. Precautions, avoid excessive hip flexion or high impact activities such as like the 90-degree angle and not crossing your legs. Phase 2 of rehab is 6 to 12 weeks. Goals, build strength, restore mobility, increase weight bearing. So at this point, you are allowed to be able to walk, but sometimes you do have to go from one crutch to two. It depends on the person, though. Exercises is strengthening, which would be like squats, and just working on flexibility and range of motion. Activities start on low impact sports like walking and biking, and precautions are still avoid high impact sports or twisting motions. Phase 3 of rehab is 3 to 6 months. Goals are to improve strength, endurance, and return to normal activities. Exercises advance strength, functional training, and balancing exercises, activities gradually return to sports and higher impact activities. Precautions continue avoiding high impact sports until you are cleared to a doctor. Phase 4 of rehab is 6+ months. Goal is full recovery, return to high level activities and sports. Exercises, sports specific training, agility, and strength conditioning. Activity, resume to regular sports and physical abilities. Activities, precautions, monitor for any signs of discomfort or instability. And that's it for my project. Thanks.